Hello and welcome to another video. In this video I'm going to talk about the topography of the lower limb. And I'm going to talk about the Obturator Canal, and then the Lacuna Musculorum and Vasorum, and then I'm going to talk about the Femoral Canal and the Femoral Triangle, and then I'm going to talk about the Adductor Canal and the Fossa Poplitea, and also I'm going to talk about the canal at the lower region of the leg. So if we start with the Obturator Canal. As you see here, this is the pelvis, and on the pelvis you can have a foramen called Obturator foramen, and here it's going to be a membrane called Obturator membrane, as you see here. And if we zoom in on that membrane, you can see that it forms a canal, and this canal is called the Obturator Canal, and it's a really important canal because it connects the pelvis to the leg, and through this canal is going to pass the Obturator Vein, Obturator Artery, and Obturator Nerve. So that is the Obturator Canal. If you go further to Lacuna Musculorum and Lacuna Vasorum, keep in mind that Lacuna means space. So Lacuna Musculorum means the muscular space, and Lacuna Vasorum means the space for the vessels. So again, this is the pelvis, and if we zoom in on the pelvis, you're going to have some ligaments that form the two spaces. The first one is the ligament, the inguinal ligament, and then you have the lacunar ligament right here, and you also have the Pectineal ligament, and then the Iliopectinus arch. And the Iliopectinus arch, so we're gonna divide the two spaces, the two lacuna musculorum vasorum. And if we'll start with the lacuna musculorum right here, the lacuna musculorum is gonna pass four things. You're gonna have the musculus iliopsoas, which consists of musculus psoas major and musculus iliacus. And it's also going to pass the femoral nerve and a nerve called lateral cuneus femoral nerve right here. Alright, so that is the lacuna musculorum. If we go over to lacuna vasorum right here, and remember vasorum is the vessel, so here it's going to pass the femoral artery. That's the red one, and then the femoral vein, and also going to pass the deep inguinal lymph node. Another thing that's going to pass here is the genitofemoral nerve, as you see here. That one is the genitofemoral nerve. It's also going to pass those four things. So that is lacuna vasorum. It's really important to remember that the Iliopectinus arch is what divides those two spaces. Alright, so if we continue with the femoral canal, the femoral canal is really important. Keep in mind that the femoral canal do not exist under normal conditions. It only appears in the pathological cases like hernia. Alright, so if we look at the lacuna vasorum again, because that's where the femoral canal is going to pass, and I've tried to draw the femoral canal for you guys. The femoral canal is going to pass right about here and then go out from the hiatus saphenous. And this canal, the femoral canal, is actually blocked. It's not a canal, remember that. It's blocked by the peritoneum. The peritoneum is going to be the membrane that covers the abdomen. It's going to be the red one right here. And it is also blocked by the intermuscular septum, and that is effectively the intermuscular septum effectively closes the canal, but allows the passage for lymph nodes like the deep inguinal lymph node. Alright, so it's perfectly closed. And on the other opening, the hiatus saphenous is going to be closed by the fascia cribrosa. Alright, so remember that it's only open in a pathological condition like a hernia, when the intestines go out from this part right here. Alright, so the next thing I'm going to talk about is the femoral triangle. The femoral triangle is located around here. If we remove the skin, you're going to see that here is a triangle. And if we zoom on that again, you're going to see different borders. And if you look inside the base of this border, it's going to be consist of musculus iliopsoas, you can see here, and musculus pectineus right here. And then on the superior side, the superior margin is going to be consist of the inguinal ligament, and then the medial, the adductor longus, as you see here, and then lateral the musculus sartorius. And it's really important borders because it helps you kind of navigate for the nerves, and it's an important ligament because it's the easiest way to access the major artery and major nerves, and doctors often use this triangle to get into the bloodstream, like for example when they're doing a coronary angioplasty, right? So the next thing I'll talk about is the adductor canal. The adductor canal is located like on the leg, and the adductor canal actually forms a way for the nerves to go through the leg, and it's bordered by, it's easier to look on the cross section. So if you cut the leg right about here, you're going to see this cross section, and if you, here is the femur, right? And this is the medial side. And here you see the femoral vein and artery, and the femoral vein and artery are bordered by the vastus medialis, and then the sartorius, and the adductor longus. So these three muscles form a canal for the femoral vein and artery and some nerves. Alright, so if we go over to the next thing I'm going to talk about is the popliteal fossa. And the popliteal fossa is located right about here, is the posterior part of your knee. So the popliteal fossa is bordered right here, as you see. You zoom in on that, it's also going to have some margins. The superior medial margin here is going to be consist of the musculus semitendinosus and musculus semimembranosus, and then the superior lateral border or margin is going to be bordered by the biceps, the femoral biceps. And then you have the lower lateral margin. It's going to be consist of the lateral head of the gastrocnemius muscle, and then the gastrocnemius medial head is going to form the inferior medial margin. So that is the fossa poplitea. And if you look even deeper on that, even deeper, if you remember in anatomy, in the posterior surface of the femur, you're going to have a fossa called fossa poplitea. That's going to be the base of this fossa. As you see here, it passes the femoral artery and femoral veins, and that exact place is where the adductor canal is going to end. Alright, so the next thing I'm going to talk about is the canal at the lower region of the leg for the blood vessels and nerves. And again, if you look at the posterior surface of the or posterior side of the leg and cut the leg right about here, you're going to see this cross section, and here you see the nerves and veins. And also going to pass some nerves right here, veins and arteries, sorry. And the first thing you see here is this soleus, musculus soleus, the big muscle, and then the flexor hallucis longus. It's going to form this canal, and the tibialis posterior and the flexor digitoris longus. That's also going to form this canal. And that was the end of this video, and I hope this was helpful.